Hello everyone, you are all welcome to lecture number 1179, and today's topic is symptoms and a reduction of water retention in our body, and that condition is called edema in medical term. And human body contains more than 60% water. And here, when I say 60% water or more than 60% water, means it is a percentage of average of water, because some part of the body like brain, heart, it contains more than 70% water. Our lung contains more than 85% water. Our bone contains only 30% water. And in this way, muscles, it contains 78% water. So if we take the average of our body water content, it is average is 60 to 70%. In between that, our body is having that much water. That's why human being, actually they are neither solid nor liquid, but in between, and that is called fluid state. So the status of human being, chemically speaking, is not solid, is not liquid, but in between, and that is fluid. So our body is already having more than 60% water, and whatever excess water is there, it is regulated and it is extracted out with the help of body part like kidney and also sweating, lot of other factors. But sometimes some excess water is retained in our body, and that excess of water, once it is retained, that condition is called edema. And in medical term, doctors they call it disease, but actually it is not bacterial or viral disease. It is just the water retention, and this cannot be 100%, we can say, treated. We cannot treat like bacteria virus. Rather than with the help of lifestyle and dietary improvement, we can drastically reduce this water retention condition that is called edema. And first I am going to discuss what is the symptom. So symptom is swelling, and it can happen in your foot, leg, knee, hand, anywhere. And the swelling is first is low grade, second is moderate, and third one is chronic. And this condition of water retention, by touching the finger, by pinching, if there is very little depression on the skin, it means it is low grade, and if it is a little bit more, then it is, we can say, moderate. And if lot of depression is there on the skin by putting our finger, it means it is chronic condition. And also, once your leg or hand, if they are stiff, and if you feel that your leg became heavy while you are walking, even if there is no swelling, it shows that there is excess retention of water in your body. And also sometimes in your hand or in your foot, if there is some swelling, or also there is some stiffness on the upper surface of the skin, some irritation, that also indicates that some excess water retention is there. And this water retention is caused by some factors. The first factor in female, is that is hormone changes. Once the female they become pregnant, that is after 4 or 5 months of pregnancy, there is a lot of drastic change in their body, their hormone changes, because the adrenal gland, which is producing estrogen, progesterone, cortisol hormones, that will start producing more and more hormones, and that is your adrenal gland, and it will start producing your progesterone, estrogen, and cortisol. So there will be drastic change in the body, that is hormonal, and because of that reason, the female will get swelling in her foot or leg. The second factor, that is kidney damage. If someone's kidney is damaged, then also there is chance of getting foot or leg swelling. It indicates that kidney is not properly functioning and filtration and extraction of water is not taking place. And also the third factor, the failure or weak heart. If your heart is not properly pumping, or if it is weak or failed, again there will be chance of water retention in your organ, that is lung, or in your foot or leg. So that is also one of the factor, that is your heart. And the fourth factor is lymphatic system. Lymphatic system is that our whole body is having networking of small capillary type of pipe, and they are maintaining the body fluid regulating. So if these pipes are damaged or poor, then again there is chance of more retention of water in body. And other factor is that is called obesity. Obesity means abdominal obesity, where there is lot of fat deposition. And when I am talking of obesity, remember it, there are two types of obesity. One obesity is carbohydrate based, and I call it poor man's obesity. The second obesity is that is protein based, and I call it rich man's obesity. So actually two conditions of obesity is there. One is poor man's obesity, means those who are consuming lot of carbohydrate, sugar, rice, and refined products, their abdominal fat deposit will be there. That is called poor man's obesity. So this poor man's obesity is very much harmful as compared to rich man's obesity, means that obesity which is caused by deposition by taking up more and more protein. That's why in Europe and America, the rich man's obesity is there, because that obesity means there will be lot of fat deposit here, chest and shoulders. But poor man's obesity means only here there will be abdominal enlargement of stomach or fat, and that we call it in Indian language toned. So toned means it is abdominal obesity. So those who are having carbohydrate based obesity, there is maximum chance of retention of excess water in their body. and I have already told you that condition in medical term is called edema, and there is no cure for that. If doctors they are claiming that they are going to give some medicine and it will be 100% cure, it is nothing like bacterial or viral. It is disorder, and some organ factors, some hormonal factors are responsible. And that one is making such type of retention of water. So only we can reduce the condition of excess retention of water in our body by modifying our lifestyle and diet and adding some vitamin and mineral, so that you can lead normal life. People are there, they have tendency of edema, means excess retention of water, and for 20-30 years they are living normal life with natural treatment by modifying the diet and lifestyle. And the other condition that is called the blood capillary rupturing. You know, we have lot of blood capillaries, and those blood capillaries, if they are ruptured and they are broken because of that, sometimes there will be more retention of water, excess retention of water in our body, and we will get this swelling. So I am going to show these images. You can see here in this image, there is excess retention of water in the food, and that is called edema condition. And here you can see by pressing, if it is skin is depressed little bit, then we can say that the retention of water is there, but it is very less. And if the depression of skin is more and more, it means finally it will be lot of depression on the skin. It shows that there is a chronic condition and someone is suffering from excess retention of water in their body, and that condition is called edema. The last condition where the depression is 8 mm, second one is 5 to 6 mm, and before that is 4 mm. So that depression is clearly indicating the chronic condition. The last one where there is depression of skin by pressing with thumb, it goes up to 8 mm. It is showing in this photo image lymphatic networking, and where lot of networking of small pipes are there. They are known as lymphatic system, and that system, if it is broken and weak, then again there will be chance of excess retention of water in our body. It is very clear picture of blood capillaries, and there are multiple millions of blood capillaries are there in our body, and these capillaries, if they are damaged or there is some leakage, again because of that damage of the capillaries, blood capillaries, there is chance of edema condition, that is more retention of or excess retention of water in our body. This is what I am showing as poor man's obesity, carbohydrate based obesity, that is abdominal obesity, and is lot of fat is concentrated in abdomen, and that condition is also responsible of retention of excess water in our body, and you may suffer from edema condition. And let me make it clear that this poor man's obesity, we call it, that is also possible, that we have lot of bulging or abdominal obesity is there because of malnutrition, poor diet. You are not getting enough protein. So that malnutrition, not getting enough protein in your body, that also one of the cause of retention of more water in your body. And here let me give you some of the important points how to treat it or manage it. First thing is, if you have such tendency of retention of excess water in your body, reduce drastically the intake of sodium chloride, that is called common salt, because sodium can bind the water in our body, and in this way water can be retained in the body. So once sodium is reduced, means the chance of binding of the water in the body is reduced. And take such type of fruit which are rich in potassium, magnesium, like a banana, like tomatoes, watermelon, all these fruit which are containing lot of water. Also, if you are taking water, this tea, coffee is very good. It works as natural diuretic. Diuretic means that tablet or substance that can immediately allow the urination, and with the help of that urination, excess retention of water will be flushed out, reduced. So taking coffee and tea, either black or green, it doesn't matter, because these contain caffeine, and caffeine is natural diuretic. So it will help you in reducing the excess retention of water. Also add to your body vitamin B6. Vitamin B6 can regulate the water in your body. It also helps in synthesis of RBC, that is red blood cell. And also add to your diet 75 mg, something like that. Consult your doctor, he might diagnose. Magnesium. Magnesium also plays important role in regulating the blood excess water in your body. So recently in some of the research papers, it is mentioned that allergic condition is also one of the very important factor of edema condition, means retaining excess fluid or water in our body. And also if there is blood clotting here and there in our body, means multiple blood clotting, it can also cause the retention of water in our body. So here I have given here that summary, what I have already told you. Edema is the excess retention of water or fluid in our body. If you have mild edema, you may be able to manage with changing lifestyle like drinking more water, tea, coffee, and staying physically active. Tea, coffee, black coffee or green tea or black tea, they are all natural diuretic. So they help a lot, and I have already shown you the condition from 2 mm to 8 mm depression of skin, that is showing whether it is chronic condition or mild condition. Number 2, swelling of the skin can cause it to dry and become itchy and irritated, and this condition of skin may lead to the risk of infection and other health complications. Number 3, edema means retention of excess water cannot be cured. If doctors, they are claiming that they are going to cure it 100%, they are telling lie, because it is not viral or bacterial disease. Here only the way to treat the condition, and that is causing the edema, so that drastically we can reduce it and we can have normal life. Best drink black and green tea. Caffeine is natural diuretic. Number 4, causes of edema. I have already told you that causes. Again, I am just mentioning them. The first cause is, that is hormone change. Number 2, I am not going to discuss because I have already discussed it. a hormone change, that is in female and other persons also. Number 2, kidney disease. Number 3, heart failure. Number 4, lack of physical exercise. 5, capillary damage. 6, lymphatic system. 7, obesity, malnutrition. Number 5, how to reduce edema condition. A, eat less salt, that is sodium chloride. Add Mg, the food which are rich in magnesium, or take magnesium supplement. Take vitamin B6 tablet. Then take the fruit or vegetable which are rich in potassium, like banana. Banana is rich in potassium. Limit refined food or stop it and go for whole grain food. Go for whole grain, and this you should add in your diet, that is spinach. Lean protein. Lean protein means stop all red and poultry product, go for fish. That fish is called lean protein. Kale and sea vegetables, olive oil and asparagus. So by taking care of lifestyle, changing the diet and following physically active life can drastically reduce the retention of water in your body, and you can lead normal life. With this I will stop. Thank you very much for watching the lecture.